Yeah. So have you ever been in traffic and someone told you because you wanted to pee that you should not hold your urine because it will damage your kidney? Today we're going to find out, is that really true? Or is that just one of the medical myths making the rounds? Can you safely hold your urine for an hour or two? Today we'll be talking about it, and we're going to be flushing out every unscientific myth from your bladder. Now let's talk about a little bit of the way the bladder functions. The bladder was made by God to store urine. It's not just a sheet of paper. It's made up of muscle called the detrusor muscle, and this muscle is distensible. That means it can increase its capacity. Even though the bladder, when it's empty, may be collapsed, it can increase its capacity and take much more urine, and take up to 500 mils of urine. There is also the way the bladder works naturally. You feel the urge to urinate. But at the point you feel the urge, the bladder is not yet at maximum capacity. It can still take more and more urine for a while. So it means that the fact that you don't empty your bladder immediately, you feel that first urge to urinate, doesn't mean that you are doing yourself any harm. Note it clearly. Our bodies function naturally in a certain way. So when you feel that first urge, if you don't pass urine, the urge sometimes disappears completely for another few minutes to hours before you have another urge. And generally speaking, the urge becomes more intense and gets to a level that you probably can no longer hold the urine. That is the body speaking. So when you feel that intense urge to urinate, if you then keep it in, that is where there may be a problem. But if the body told you about 2 hours ago you need to urinate, and you are in the middle of something, 10 minutes, 20 minutes, you finish up, you go and empty your bladder. If you are in traffic for a few minutes, get out of traffic, go and empty your bladder. So we're going to be dealing with a few myths. Myth number one: people will tell you if you keep urine in your bladder might explode. Tell me how. Your bladder will not explode. The only circumstance where the bladder may burst is when there is trauma to the bladder when it is full. So if your bladder is full and you are involved in a road traffic accident, there can be a bladder injury. If your bladder is very full and you are playing football or something and somebody kicks you in the bladder, then there may be a bladder injury. Only then, not just because you are keeping urine in the bladder. Myth number two: some people will tell you it will cause kidney failure. How? It doesn't cause kidney failure. Please stop spreading wrong information. 3, some people will say it causes infection. Our bladders naturally keep urine. That is what they are for. So you don't say that because you kept urine in your bladder for an extra 10 minutes, you are likely to have an infection. That is wrong information. Note of caution: the number of people need to be careful about holding their urine. 1, if you have a prostate problem, where you are encouraged to empty your bladder frequently because you already have the prostate that is blocking the outflow of urine. So if you keep urine for so long, or you take lots and lots of water or alcohol and your bladder becomes full, you may develop what we call urinary retention, where you may not be able to pass urine easily. For people who have kidney stones, that may increase the pain that you have. And people who have spinal cord issues or who have diabetes that has affected their nerves, we encourage them to empty their bladders routinely because their bladders naturally can overfill. Here's the rule of thumb: if you can't find the toilet, there's no harm in keeping your urine for an extra 10 or 20 minutes. Drink water normally. Don't say because you don't want to pee, you're not going to drink water. And you should empty your bladder regularly, especially before long trips and long meetings. Next time someone says holding that pee for the next 10 minutes is going to spoil your kidney, tell the person, not true. Dr. Peter explained it. If you enjoyed this myth-busting episode, kindly like, subscribe, and share with your friends. Bye for now.